Health Minister Phaahla says government is making progress in dealing with the cholera outbreak. He's confirmed that no new deaths have been recorded in recent days. The minister says there's also been a marked decrease in the number of new infections.
Cholera can be very quick. It can start slow, cramps, abdominal pain, a little bit of vomiting, and then when it goes in, you just lose fluids. Because a number of patients who died from loss of fluid, which leads to kidney failure and other organ failure. So the quicker, that's why we then went on various messages to get people to come, and we're happy to announce that people have been coming, and as a result, as you can see, in terms of serious illness and even in terms of deaths, we haven't had any in the last few days. There is definite downward trend, even in terms of just the diarrhea generally, and also in terms of cholera itself, in terms of serious illness. Again, also in terms of severity, therefore, in terms of any reported deaths, as I've indicated, in the last 7 days, there have been only 2 deaths from last Wednesday up to yesterday, only 2 deaths, and I'm quite certain that those were also in the latter part of the last 7 days, Friday, Saturday of last week, and since the beginning of this week, we have not had any report of any new deaths. So at this stage, from a health point of view, we want to thank all the parties which have been we've been working together. So we're noticing very promising trend in terms of very steep downwards trend, and we're optimistic that sooner rather than later the situation will be contained.
Let's talk more about this with the Health Department spokesperson, Foster Mohale, who's joining us tonight on News of Prime. A very good evening to you, Foster. I'm grateful for your time. The Minister encouraged by a steep decline in cholera cases, but there are still cases being reported. Is Hammanskraal still the area with the highest count?
Yeah, good evening to you, Temehile, and good evening to your viewers at home, and thanks for this opportunity once more. Yes, we can, all the efforts that we've invented, the interventions that we have to put in place in order to keep the spread of this bacteria, but also try to save lives. So all the good work that we have done in order to achieve this milestone, it was through the it was through the efforts by all the collective partners, both the government and non-government organizations that join hands with the government in order to ensure that we continue to disrupt the spread of this bacteria and also saving the lives. As the Minister of Health, Dr. Phaahla, has indicated earlier on, that because of the interventions that we have put in place, we have slowed down the infection rate and mortality rate for the past 7 days as compared to a few days prior.
You've slowed it down, but you've not got rid of it altogether, which suggests that there is still an issue either with the water or cholera spreading in other ways in these communities.
Yeah, no, definitely. We are well aware that until we have found the possible cause of this outbreak, we are not going to relax. We are going to continue intensifying our efforts while those who are responsible for investigations into possible cause of this outbreak, they continue the investigations. Hence, the Department of Water and Sanitation, working together with other entities and the City of Tshwane, tomorrow they will be briefing the media as far as their progress with the investigations into possible contamination of or possible outbreak of this bacteria in the area, especially with regards to water sampling.
Has the source of the outbreak been found? Has it been identified?
Look, so far, not yet, because we don't even know, because we don't want to run into a conclusion that the source is the contamination of water or contamination of food. Hence, we want to allow those who have got the capacity to investigate through different methods to assist in order to find out what could be the possible source. But from the Department of Health, we'll continue to capacitate the health facilities to continue to intensify awareness campaign in order to empower the communities with health information to make well-informed choice. Hence, we have to set up our failed hospital in one of the communities which was considered to be an epicenter community of Ghana around Hammanskraal. And since we set up this field hospital, we have seen a lot of people coming to this hospital presenting themselves with one or two signs and symptoms of cholera. So that shows that people were waiting for this kind of service to be brought closer to them in order for them to present themselves, because we have noted that one of the challenges was late presenting by suspected patients at our facilities, especially the Jubilee Hospital, which serves the community of Hammanskraal and neighboring communities. So since we set up this field hospital, we've made a huge impact as far as encouraging people to come forward as soon as they experience one or two signs and symptoms of cholera.
Some experts we've spoken to have said that the pursuit for a source of this outbreak is basically a useless one, a pointless exercise, because if the first people who became ill with the severe bout of illness as a result of cholera in Hammanskraal in particular began to get sick, let's say, at the very least 2 weeks ago, and if the source was indeed water, drinking water in that area, it's unlikely that a test conducted in the last week or so would be able to produce an accurate result, or one that would indicate if indeed that particular flow or source of water was the problem. Is it pointless at this point?
Yeah, no, the answer we said we don't want to jump into conclusion. We know that the challenge of water quality supply in the area of Hammanskraal is historic in nature. So hence the National Department of Water and Sanitation, working closely with the local government and the water boards, talk of Mahalis, we talk of rainwater and Rooiwal water system, in order to embark on parallel investigations, testing water samples from different points at different times. As you know, that testing water is completely different from testing blood. With blood, we can draw blood from your body and take it to the lab. There we can be able to get the result. But with testing the water, because water flows from the plant to the communities through different channels, through different pipes. So meaning that you need to test water at different points at different times. And also remember that the community of Hammanskraal, they also rely on water which is provided to them through the water tankers and through the JoJo tanks. So I believe the team is working around the clock in order to test all the sources of water, the JoJo tanks, the water tracking supply, in order to find the possible sources, because looking only at water plants, that may not be able to give you a true picture as far as the possible cause of contamination of water is concerned. But as the Department of Health, we don't want to jump into conclusion to say it's precisely because of the quality of water in Hammanskraal.
Which brings me to my next point, that it's good and well to test the water, but if the source of the cholera outbreak, or shall we say, as we did in the COVID days, patient zero, if that's how it was introduced into the community, that is likely to never be identified at this point, am I right? If it came through any other means but water.
Yeah, look, remember, let me try to educate you and also to the viewers that there are many ways of contributing factors that may lead to an outbreak of diarrheal disease or cholera. One of them, of course, is contaminated water. The second one is contaminated food. So hence we always encourage people to maintain personal hygiene at all times. Make sure that they wash the food thoroughly before they cook. And remember that especially there are certain food like fruits that people will buy on the street, like your apples, that you can buy and eat without washing, unlike bananas and your oranges, because you have to remove the skin. So hence we always encourage people to say, whatever you buy on the street, in the shop, please make sure that you wash it with water before you consume, because you don't know, with your naked eyes, you may not be able to see whether that food is contaminated or not.
But that's exactly what I mean, that if the source of the outbreak in Hammanskraal, the initial first few people who got sick, if that started from another source, not water, let's say contaminated fruit, it'll be near impossible at this point to determine that, right?
No, definitely it will be impossible, but hence we say we are trying to test different suspected contributing factors to this outbreak. So we are not only focusing on water. Our epidemiologists, they are trying to look at different possible contributing factors to this outbreak.
Foster Mohale, Department of Health spokesperson, good to speak to you. Thank you.